move this one, you see these jagged edges that I was talking about, they form three-dimensionally all around in these joints over here. And when I try and move this, it moves, but notice how it's not moving as much or as smoothly as the other one. And so when I'm adjusting a patient, I'm checking for areas that are tight or not moving properly, with my goal being to get it to move a little better, which really means that we're getting pressure off the nerve, the muscles are relaxing, but that's the goal of the adjustment. Hi, Dr. Michael Pasternack here from Winchester Spine and Injury Apple Wellness Center. You know, I've had some patients wonder, why two names, Apple Wellness Center and Winchester Spine and Injury? That's a really good question. So Apple Wellness Center really just reflects that I've been in practice 31 years and I see a lot of patients and I treat them with a bunch of different types of therapies. You can watch my other video where I talk about that. And Winchester Spine and Injury really reflects the last 4 years I've been specializing in like whiplash type of injuries, car accidents, and so it's reflective of that. In any case, so today's video is going to be about adjusting the neck and different types of techniques I would use. And by the way, here's Clarence. He's gonna be getting adjusted today. But before I get into showing and demonstrating the actual adjustments, I wanted to just talk briefly about, well, why would we adjust someone's neck? And adjustment is a fancy name for a treatment. So let me take just a minute and talk about, well, why I would adjust someone, because then it will make better sense. So if we look over here for a moment, so here's like a plastic model, and you're looking at the spine from the front. You can see the vertebra, the bones, and then this would be a disc. And then if we look at this from the side, you can see a nerve over here, and you can see the spinal cord. So normally, the messages go up and down the spinal cord and they go out the nerves, and that's what the flashing green light is showing. But what I want to show you is if I move this bone just a little bit out of place, you see how that interferes with the messages? So that's a problem. That's what we generally work on here in the office. And this would be normal over here. And then it's showing a progression of what happens to the spine if you have like a pinched nerve like I was showing you just a second ago and you don't correct it. Little by little, it's gonna degenerate and wear out and turn into this. And so the important things here is you can see the discs are nice and thick over here. And then if you compare the discs here versus what you see over here, I think you can see how those discs are getting thinner, not a good situation. And eventually they're gonna dehydrate. It sort of looks like beef jerky. It should move nice and smoothly, sort of like that. Move this one, you see these jagged edges that I was talking about, they form three-dimensionally all around in these joints over here. And when I try and move this, it moves, but notice how it's not moving as much or as smoothly as the other one. And so when I'm adjusting a patient, I'm checking for areas that are tight or not moving properly, with my goal being to get it to move a little better, which really means that we're getting pressure off the nerve, the muscles are relaxing, but that's the goal of the adjustment. I specialize in whiplash and car accidents. The thing with those folks is often, especially in a newer accident, more recent, those muscles are really tight and they're not able to move very much. So I start out with very gentle types of adjustments. So that's what I'm going to show you. I'm going to start out with the most gentle type of adjustments because that's what I do a lot, especially with patients that are older or if they have a lot of fusion and they don't have movement or if they've been in a recent car accident. So Clarence, if I could have you lay on your back for me with your head up over here. So this would be how I would adjust. It'd be more of a gentle stretch. So I'm gonna be pulling or stretching. I'm gonna feel for an area of the spine. And like when I feel over here, I can feel that tightness like I was showing you on the models. And I already felt that move a little bit. Did you feel that, Clarence? Yes. And that may be all I do on someone that's just in a recent car accident or, you know, is fearful of being adjusted in other ways, just gentle stretching like that. And so again, I'm getting right on that joint and I'm just pulling towards me, stretching it to loosen that up. The second type of adjustment, if they could handle just a little bit more, is I'll feel their neck to see where it's moving. and it feels a little tight here, so I'm gonna get right on that joint. I'll show you with my hands first, and I'll put my hands right on the joint and my hand on his head, and I'm gonna push both ways just a little bit to stretch that joint. And so I'm just a gentle pressure, and I'm pushing with my left hand going forwards, and the hand that I have on his forehead, I'm pushing back just a little bit to create some tension and to stretch that joint where it's tight. Because remember, the goal is to get things moving better. You doing okay, Clarence?
Oh, that feels great.
Awesome. Now, the next type of adjustment I would do, and really it's won me over, I love it, it's an instrument adjusting. The reason I love this instrument is it lets me get some movement into those joints quicker than those muscles can tighten up, so it's very gentle but effective. So again, I would feel his neck to see where it's normal versus not, and so it's a little stuck over here. So then I gently, and that's why they think it sounds like a woodpecker or a jackhammer, and then I'm going to come back and feel, because the bottom line is it needs to loosen that joint up or we're not done yet, because that's the goal of getting the adjustment, remember? So that's moving some better. So that would be the next type of adjustment. Now, the next adjustment I'm going to do is what most patients probably typically think of when they get an adjustment. I'm really smooth with this type of adjustment. I'm very gentle. I try not to, I never force it, so if it's not ready to go, I'll use one of the other techniques. And so patients are often able to relax where they couldn't with maybe in other times, and often we're able to get some good movement. So I'm gonna feel his neck again, so I know where it's tight or not. And then I'm gonna turn his head a little bit, and then I'm just a gentle thrust. That went really well. I don't know if you heard that on the video. How'd that feel, Clarence?
It felt great.
Let's try this side. So, I have one other adjustment that I do, but I don't do very often. Clarence, when he called up, specifically asked if we did this type of adjustment, so I said yes. So I'm gonna go grab a chair and bring it in. I'm gonna show you the adjustment that I was doing for Clarence. And relax your head. Still didn't get any more movement with that one. But that's
actually you did.
Well, there you go, showed you what I know. Clarence is the expert, so got a little bit of movement. So when he called up, he asked specifically about that technique. So thanks for watching the video. If you have any questions or comments, certainly go ahead and respond down below, and I'll make sure we answer that. And you can follow us on social media. And if you know anyone that is interested, share the video with them. Have a great day, and thank you, Clarence.
No, you're welcome.